I welcome you all from wherever you may be watching us. Today, I want us to have a look at a very interesting presentation, and that is fever. Fever, or hotness of the body, is a very common presentation or symptom that patients do present with. And therefore, it's very important for us to be able to analyze and actually understand what fever is. Now, fever is medically referred to as pyrexia. So the medical word or terminology for fever is pyrexia. And fever refers to the rise in body temperature above the normal range. And it's important to note that the normal range of the body temperature is between 36.1 degrees Celsius to 37.2 degrees Celsius. It's also important to note that the normal average body temperature is 37 degrees Celsius. So those are key fundamental points that we need to take into account when dealing with a patient with fever. Now, there are several types of fever that we are going to have a look at today. The first one is called the continuous, sometimes referred to as persistent fever. And this type of fever is common in patients suffering a condition called typhoid, which is simply referred to as typhoid fever. Patients with bacterial pneumonia also present more often with persistent or continuous fever. Those are just but a few examples of cases presenting with continuous type of fever. The next type of fever is called intermittent fever. And this type of intermittent fever actually is very common in patients who have infections or infestations with organisms such as those which cause malaria. So patients suffering malaria, in more or most cases, they do present with intermittent fever. Patients who have been infested with leishmania parasites, patients with trypanosomiasis, those are more of parasites or parasitic infestations. So they more or mostly present with intermittent fever. The next type of fever is called the remittent fever, and this is more common in patients suffering brucellosis, or a condition referred to as infective endocarditis. The next type of fever is called the pale Epstein fever, and this is common in patients with cancer, particularly the Hodgkin's lymphomas. The next type of fever is called the undulant fever, and this can also be seen in patients with brucellosis. Now, when you look at the intermittent fever, which was our second type of fever, it has got three major types. So there are three types of intermittent fever. The first one is called the quotidian fever. The second one is called the tertian fever, and the third one is called the quartan fever. The three types of fever are very common in malaria disease, or what we call the falciparum organism. That is a type of parasite which causes malaria. So patients with malaria, in most cases, will present with either of the three types of intermittent fever: the quotidian fever, the tertian fever, or even the quartan fever. Now, there are several causes of fever, and we'll have a look at each cause one by one. And before that, it's important to note that this list is not conclusive, but then we'll be able to highlight various common causes of fever. The first one, of course, is called infections. And under infections, we have four categories. The first one is called bacterial infection. And under bacterial infection, the common one is the UTI, or urinary tract infection. We can also have the respiratory tract infection caused by bacteria that are commonly available or commonly infect the respiratory tract. This is seen in patients with pneumonia, bronchitis, and many more. The next example of bacterial infection is typhoid. And typhoid is also very common, and we'll have an ample time in our next videos to talk about typhoid in great details. Organisms such as those which cause brucellosis commonly cause fever, and in this case, the infective type of fever. The second type of infection is the fungi. And under fungi, we have the common one, or the most common one, which is referred to as the valley fever. So there is a fungi which commonly causes the valley fever. The third type of infections that can cause fever is the parasitic infestations. And in this case, the most common one is malaria. We can have leishmaniasis, or even trypanosomiasis, and many more. The fourth type falling under infection is the viral infections. For example, the viral pneumonia, the coryza, or simply common cold. Now, our next cause of fever are what we refer to as the hormonal disorders. For example, patients with hyperthyroidism or hyperparathyroidism. The next cause of fever is heat exhaustion, or what we refer to as sunburn. The next cause of fever is the various autoimmune diseases. For example, rheumatoid arthritis, the systemic lupus erythematosus, commonly referred to as SLE, scleroderma, or inflammatory bowel syndrome, or inflammatory bowel diseases. Now, the next cause of fever are medications, and these can fall in the categories of various side effects of various medications. For example, it can be as a side effect of antibiotics, and many other examples. The next cause of fever can be immunization or vaccines, as seen in children vaccination, patients who have been given tetanus toxoid vaccine, or even the diphtheria vaccine, plus many others. The next cause of fever is blood clot diseases. For example, the deep venous thrombosis, commonly referred to as DVT. The next cause of fever is cancer, and just as I've said, the most common type of cancer presenting with fever is the Hodgkin's lymphoma. The next cause of fever is poisoning, and this can be seen in organophosphate poisoning or even food poisoning. Ladies and gentlemen, as you can see, there are several causes of fever, and therefore fever does not necessarily mean infection alone. The use of antibiotics in patients with fever should then be taken with a lot of caution, as fever is not an indication for antibiotics. Let's be very cautious whenever we prescribe antibiotics, especially when patients present with fever, but rather shift to thorough investigation, and let's thoroughly investigate the patients to actually ascertain or even eventually confirm the exact cause of fever in each and every client. If you are watching us for the very first time, kindly subscribe, and until next time, it's goodbye from all of us.